Facility management and safety is the third management-centered chapter. The starting point for accreditation is the IK Organization Standards Book, the guidebook to the ECHO standards, the annexures to the 4th edition standards, and the AIOC CME series are excellent resources. The intent of the facility management and safety chapter is to provide a safe, energy-efficient environment for patients, families, and staff with plans for managing equipment, utilities, and emergencies. The FMS chapter for IK organization has 4 standards and 17 objective elements. The first standard deals with safe and environmental friendly practices. The second standard deals with biomedical equipment and utilities, while FMS 3 elaborates on water and electricity. The last standard deals with fire and non-fire emergencies. For entry level, the number of standards and objective elements are nearly the same as IK, but Healthcare Organization 5th edition has nearly double the standards and nearly 3 times the objective elements. FMS 1A states that a maintenance plan must be clearly documented for each component of the hospital: facility, building, infrastructure, general equipment, and biomedical equipment. Furniture is separately covered in FMS 1D. Everything must have an operational plan and a maintenance plan that include preventive maintenance and breakdowns. FMS 1D specifies the need for pest control. The IK organization should have as-built drawings of the layout and buildings with floor plans showing utilities. The recommendations of the Indian Public Health Standards and the National Program for Control of Blindness are good resources in planning space utilization. FMS 1E addresses environmental issues with rainwater harvesting, recycling, and energy efficient use. All organizations need to have facility rounds periodically to monitor safety. The NABH has made it possible to do most of the audit work online and specifies the areas that should be documented in the facility rounds. Geotagged and timestamped pictures of the various listed areas can be uploaded for audit. The organization should create a multidisciplinary safety committee, as a lot of documentation is required for facility management and safety. The committee must have its terms of reference detailing the composition and tenure, roles and responsibilities, as well as objectives and functioning. Minutes of all meetings must be maintained. Monitoring of effectiveness of the committee should be assessed by the management based on the action taken reports. FMS 2 deals with equipment, clinical, support, and utility. 2A deals with the strategic plan for acquiring equipment to meet the scope of services. Critical equipment is identified. Equipment to meet the needs of vulnerable patients like wheelchairs and stretchers are also identified. 2B deals with the inventory management. All assets should have a unique identifier for each equipment. 2D deals with the calibration of equipment to validate that measured results are accurate. An operational plan based on the user manual is required for FMS 2E. This is separate from the preventive maintenance plan and the breakdown register. FMS 2F. The IK organization should have a documented procedure for equipment replacement and disposal. FMS 2G is a separate objective element for maintenance of the information technology and communication network. FMS 2C ensures that only trained and qualified personnel operate and maintain the medical equipment. Operational plan means that users should have training in the daily operations of the equipment and also perform necessary user maintenance. The instrument maintenance course of Arvind Eye Care Hospital, Madurai, conducted by LICO, is a very good resource for in-house maintenance training to extend the life of equipment. The IK organization should have provisions for safe water, electricity, medical gas, and vacuum systems according to FMS 3. 3A addresses that water requirements should be available 24/7. The water requirements can be calculated from the National Building Code, and adequate portable water should be available round the clock. FMS 3B addresses the need to have backup for any supply failure or shortage. For example, the organization may have an agreement to purchase water. Either way, the water quality should be tested. Similarly, for electricity, the needs are calculated based on the installed and sanctioned load of the building, but alternate sources depending on the criticality of the activity are needed. For example, the operation theater complex, diagnostics equipment, and IT department should have inline UPS. An automatic switchover to the diesel generator set or solar power could be other options. FMS 4 deals with emergency planning. The expected outcomes of such planning include prevention of occurrence of incidents, control of incidents to minimize the loss to lives and property, compliance with regulatory requirements. The devices available for early detection include smoke detectors, surveillance cameras, manual and automatic alarms. Fixed or semi-fixed systems for fire abatement and containment include fire hose, wet races with sprinkler systems, etc. Portable systems are the fire extinguishers, and staff must be trained in the pass technique, pull, aim, squeeze, and sweep technique of use. FMS 4B has a documented safe exit plan in case of fire and non-fire emergencies. The nearest escape route should be clearly marked. Elevators should not be used in the case of fire. Staff need to be trained in the care sequence response to fire. Close the door, alert others, report the fire, and evacuate the building. FMS 4C deals with staff training. Staff should be trained in its role in case of any emergencies. Non-fire emergencies that we need to be prepared for include floods, child abduction, and violence against medical personnel. Analysis of mock drills should include response time, protocol variations, and team approach. Mandatory KPIs related to the facility include CQI4C, that is bed occupancy, OT utilization, and critical equipment downtime, while CQI4B relates to falls. Finally, since quality is a journey and not a destination, we need to look at previous audit reports and check if a root cause analysis was done and the effectiveness of the corrective actions. Thank you.